Welcome to Easy Medicine, where we simplify high-yield medical concepts for Step 1 in clinical learning. In this video, we're going through a series of high-yield pathology cases designed to help you think clinically and reinforce the concepts that are most commonly tested on exams. Each case is based on real Qbank-style scenarios, focusing not just on the correct answer, but on truly understanding the mechanisms behind it. If you want to review efficiently, strengthen your clinical reasoning, and learn medicine in a simple and practical way, you're in the right place. Let's get started. Case 1. A 47-year-old woman, gravida 2 para 2, comes to the office after noticing a pea-sized lump in her right breast while taking a shower. Her medical history includes 3 pack years of cigarette use during her 20s. She underwent infertility treatment and in vitro fertilization for both pregnancies. There is no history of breast or ovarian cancer. Physical examination confirms a firm, fixed nodule in the right breast with a small patch of overlying puckered skin. Mammogram findings are highly suspicious for malignancy, and a needle biopsy reveals infiltrating ductal carcinoma. Right mastectomy and axillary lymph node dissection are scheduled. The question is, overexpression of which marker is most associated with aggressive disease? The correct answer is HER2. HER2, also known as ERBB2, is part of the epidermal growth factor receptor family. It is overexpressed in approximately 20 to 30% of breast cancers. It is a transmembrane glycoprotein with tyrosine kinase activity that increases cell proliferation. HER2 overexpression is associated with poorly differentiated, rapidly growing tumors, and is clinically important because it predicts response to targeted therapy with monoclonal antibodies such as trastuzumab. Case 2. A 26-year-old man presents with myalgia, nasal congestion, and cough. His temperature is 38.3 degrees Celsius. Examination shows nasal and pharyngeal hyperemia. Rapid influenza testing is positive. Inside infected cells, viral proteins are degraded and presented on MHC class Y molecules to CD8-positive lymphocytes. The key question is, what is essential to initiate this immune process? The correct answer is ubiquitin ligase. The ubiquitin proteasome pathway is critical for breaking down intracellular proteins. Ubiquitin ligase tags proteins with ubiquitin, marking them for degradation. These protein fragments are then processed and presented on MHC class I molecules, allowing cytotoxic CD8-positive lymphocytes to recognize infected cells and induce apoptosis via perforin and granzyme release. Case 3. A 24-year-old man presents with recurrent abdominal pain, bloody diarrhea, low-grade fevers, and fatigue. Examination shows left lower quadrant tenderness. CT scan reveals thickening of the distal colon and rectum. Laboratory testing shows an elevated erythrocyte sedimentation rate of 50 millimeters per hour. The question is, which substance is most associated with this finding? The correct answer is interleukin-6. This patient likely has ulcerative colitis, a chronic inflammatory condition. Inflammation leads to increased cytokines such as IL-6, which stimulates the liver to produce acute phase reactants. These proteins promote rouleau formation, where red blood cells stack together and settle faster, increasing the erythrocyte sedimentation rate. Case 4. A 36-year-old woman presents with non-tender left axillary lymphadenopathy. She feels well otherwise. Ultrasound-guided biopsy is performed. Microscopy shows cells positive for cytokeratin staining. The first question is, what is the lineage of these cells? The correct answer is epithelial. The second question is, what is the function of a 185 kD transmembrane glycoprotein with tyrosine kinase activity that is overexpressed in these cells? The correct answer is increased cell proliferation. This protein corresponds to HER2, which activates signaling pathways that promote epithelial cell growth and survival. HER2-positive tumors have higher proliferation rates, resistance to apoptosis, and worse prognosis. Cytokeratin is a structural protein found in epithelial cells and is commonly used as a marker for epithelial-derived tumors, such as breast cancer. Case 5. A 60-year-old man develops diarrhea, abdominal pain, nausea, vomiting, and anorexia 3 weeks after starting radiation therapy for prostate cancer. Sigmoidoscopy shows inflammation, edema, erosion, and ulceration of the intestinal mucosa. The question is, what is the primary mechanism responsible for these changes? The correct answer is generation of reactive oxygen species. Radiation causes cellular damage through DNA, double-strand breaks, and the formation of oxygen-free radicals. These reactive oxygen species damage cellular components in DNA, leading to inflammation and tissue injury. Case 6. A 32-year-old chef sustains a laceration to the tip of her thumb that extends into the subcutaneous tissue. The question is, what is the correct sequence of wound healing? The correct answer is fibrin clot formation, followed by cellular infiltration, and finally, angiogenesis. Wound healing begins with clot formation to stop bleeding and provide a scaffold. This is followed by infiltration of inflammatory cells and fibroblasts. Finally, angiogenesis restores blood supply and supports tissue repair. And that's it for today's high-yield pathology cases. If you found this helpful, remember that Easy Medicine is designed to simplify complex medical concepts and help you review efficiently for Step 1 in clinical practice. The goal is not just to memorize answers, but to truly understand the mechanisms behind each case. If you want more high-yield content like this, make sure to subscribe and check out the next video in the series so you can keep building your clinical reasoning step by step. See you in the next one.